This conversation about access to healthy foods leads into our next session as we look at food as medicine, which we've talked a little bit about today. I'd love to welcome our panel, starting with the moderator of this session, Kate Warren, the executive editor and executive vice president at Devex. They're a wonderful news outlet. You should all read them, subscribe, do whatever you can, so please do that. Our next is Joy Chevalier, the chair of the Austin Travis County Food Policy Board and the founder of the Cook's Nook and a longtime friend of Food Tank. Michel Nischan, my hero, who is the co-founder and executive chair of Wholesome Wave. Melanie McAfee is the owner of Barr Mansion, and I can't thank her enough. Please give her another round of applause. And Dr. Shreela Sharma is the director of the Center for Health Equity and, the center, I'm going to say it all over again, pretend it never happened, is the director of the Center for Health Equity and a professor and vice chair of the Department of Epidemiology at the University of Texas, Houston. Kate, I'm so happy to turn it over to you.
Thank you. I'm so happy you read all of those titles.
Thank you.
Thank you, Danny. Yes. Let the panelists come on stage. So I'm really excited to have this conversation about food as medicine with a really wide-ranging group of perspectives here. But first, Shreela, I'd like to start with you. What is food as medicine? Let's table stakes it. What does that actually mean? What is the definition of that?
Yeah, happy to share, but first I want to give a shout out to my University of Texas colleagues and alumni and students. So strong representation in the room. Great question to start with, and that's because as a registered dietitian, food has been part of the healthcare system for a long time, but food as medicine has taken it to the food equity space. And so food as medicine is largely defined as essentially providing access or improving access to fruits and vegetables or healthy food to prevent, treat, or manage disease, diet-related diseases, and it's integrated within the healthcare system. So I think those are the three anchors when we think of food as medicine, and it's gained a lot of popularity. And what's particularly exciting, I'm a registered dietitian, and a lot of the work that we used to do within health systems was focused around education, right? But how many people don't know that fruits and vegetables is good for you? There's not one human on this planet that doesn't know that, right? So to me, this is exciting because we are addressing food equity and working with communities and families that need it the most and bringing fresh fruits and vegetables and healthy food into the hands of those who are actually struggling the most with these diet-related chronic conditions and food insecurity. So we are addressing food equity and integrating that into a healthcare system that has not paid for addressing these issues is the part that's most exciting.
So Joy, I'd like to bring you in with the Cook's Nook. You are working on this health equity issue and bringing food as both a source of food security, but also nutrition. I think when you hear food as medicine, you might see that as, oh, that's a good alternative to medicine, but you also might think, food is medicine? Yeah, you want food to be exciting and
right.
Good. But you really focus on cultural relevance. Right. And can you talk a little bit about the importance of that?
Sure. Can I give a shout out to our Austin, Texas food ecosystem? There are so many of you guys who are in this room. From our hospital systems to our CBOs to our city. I see city and county folks walking around, and of course my own team. So thank you guys so much for being here. And you're absolutely right. The Cook's Nook is a nutrition solutions provider. And what does that mean? We actually help design and build programs that people want to stay in and be in. They want to not only have the nutrition that looks, smells, tastes, is representative of their life and lived experience, but done in a way, done as part of the program, done as part of this combination of, of food insecurity, but trying to manage or prevent some diet-related disease, which is, of course, about $13.6 billion in a $4 trillion system. That's preventable. And so to Dr. Sharma's point, us providing nutrition, providing tools for folks like her, folks who are in hospital systems, ACOs, MCOs, insurers, benefits platforms. How do these guys actually have the programs that meet people where they are? They are the ones who are on the ground in their community, and our job in the Cook's Nook is to manage that supply chain. We've heard folks talk about find that food, find that nutrition, create it. We create everything in-house and be able to get it out in a program that actually, the program itself is rooted in equity as well.
Right.
So.
And Michel, at Wholesome Wave, you partner with community-based organizations and provide seed funding and co-design and trying to make the case for more private-public sector investment in this. Can you talk about the role of government, private insurers, philanthropy in advancing food as medicine?
Yeah, the role for them is to get off their tuchus, frankly. So if for whatever reason I use some language that might be a little bit unseemly for some, I am a chef. I've been a chef for 40 years. Yeah, actually the role of Wholesome Wave, we started, so you all have heard about doubling SNAP for fruits and vegetables. So I co-founded Wholesome Wave with the late Gus Schumacher, after whom the Gus Schumacher Nutrition Incentive Program is named. We created doubling SNAP for fruits and vegetables when it was illegal. You could not provide, yeah. Well, that Paul Newman funded it because it was illegal, okay? He just thought it was cool because he's like, how do you shake things up? And sometimes you need to shake things up to actually get the attention of government officials because they get stuck. And we hear these words, multi-stakeholder, de-siloing health and food. It's so much of what we see as culinary professionals is just common sense. Yeah. You are what you eat. I believe in food as medicine, the movement, because it's sticking and people are getting it. But as a chef, I don't think of food as medicine because medicine is not delicious. It will never be delicious. Break open a capsule, put it on your tongue. It's not going to taste good. But what it does for you, if you have the knowledge that you need to really understand how to incorporate healthy food in your life, it has profound power in mitigating, reversing the effects of these horrible, non-communicable diseases that are literally causing 70,000 amputations a year, which is 10 times more than the Gulf War and all the Afghanistan conflicts. So I think the role of government officials is to stop really demanding the evidence bases at large-scale numbers that they're looking for, because there are plenty of studies dating back tens of years and
studies going on now.
Yeah, in Framingham
7,000
size,
to be exact.
Yeah.
There's
Yeah.
over 7,000 studies.
Yeah, that demonstrate simply increasing your consumption of fruits and vegetables, 3 servings a day, is going to mitigate your risk of dying from a number of diseases without changing anything else. Mm-hmm. Then imagine the power to change everything else because you actually have the affordability to do so. So I think there's no question that food is cheaper than dialysis at $100,000 a year a patient.
But they keep asking us to prove it.
Yeah, prove
I was going to
it.
say,
They're asking us to prove it.
What is the response from
So
insurers?
I just think often public officials kind of hide behind it, and I love what HHS did with the Food as Medicine Summit. But you know, when the Admiral had their panel with the heads of the 6 departments, all they talked about, what they really see and what they hope for, is to really see the evidence base build. I don't know about y'all, but I'm sick and tired of hearing about the evidence base. We know what happens when low-income families have access to good, healthy, locally grown food. We know my shout out is Sustainable Food Centers here. They've been running SNAP doubling and produce prescription programs for over a decade now. It just, I think their job is to listen to the people that live in this nation, that care about their neighbors, that are coming up with these awesome ideas, and unlock the federal funding that makes it possible for low-income families to exercise their non-amendment, because it's in the Bill of Rights, right to feed their family well.
Can I add just a number to this?
That's what they
So
gotta do.
less than 5% of the $4.3 trillion in healthcare costs go towards anything related to prevention. 95% goes towards your medication and surgical care. $4.3 trillion. and we're just getting sicker as a nation. So, I mean, it's untenable and unacceptable for us to continue down the path that we have.
And so while we continue to run pilots, and we're all running pilots of some type, right? Whether it's in a hospital system where it is a particular doctor's study, or whether it's with the city, counties, and CBOs, right? We're not able to get your state and federal dollars unlocked in a way that makes sense, where food is medicine becomes a standard of care. Right?
We're going to change that, though.
Yeah.
We're going to change that, right? Yes.
Kale, yeah.
Well, I want to bring Mel into the conversation. And so, this requires a lot of big systems change, but also requires smaller level change and bringing in companies. So for those of you who know, she owns this beautiful place that we're at, so thank you very much for hosting us. Barr Mansion is a zero-waste facility. I love your tagline, that saving the planet one party at a time. So what a party we're having here today. I've been downtown for South by all week, and it's a literal breath of fresh air out here. So thank you for hosting us. But as you think about as being a business owner, what is the business case for thinking about food in a sustainable, nutritious, healthful way?
Well, so I've been at this for a minute, but let me just say that it is such a pleasure to be working with Food Tank. They have been such an inspiration for me, and I think they are just leading the charge in the food world. So please, let's give them a hand. So with that said, I have been passionate about the environment for a long time. So I kind of came in from that angle and was so excited about the organic movement. Mm-hmm. So I became certified organic 14 years ago when I had to defend the kind of ugly vegetables and the high prices. Yeah. So it was a brand new world, and people were resistant, but look where we've come. So I think that as a business, I was told over and over, it can't be done. It's too expensive, people don't want it, and it won't work. Well, I'm here to tell you, it did work and it can work. So my message to all of you is that wherever you are and whatever you're doing, that don't let the naysayers come get you, because it turns out maybe our clients and our brides weren't necessarily looking for the organic menu, but we gave it to them anyway. And it turns out they liked it and came back with good things. Yes. So my next journey, and we'll see how this goes, is I really am worried about climate change. So we need to eat different. And I host lots of weddings. So they all want cream and butter and lots of meat. So my challenge is to inspire them that a plant-based meal can not only taste great, it can look 10 times prettier.
I was just going to add a little bit. I mean, the idea that we have to work very hard to demonstrate that whether you're a nonprofit or, in our case, a for-profit social impact business, is incompatible with the general structures of business in order to provide these solutions into space. It's just false, right? The question is always, are we hitting the target with the product in the market? In this case, and Michel said it, right? This work was actually illegal, right? It's only recently that the Center for Medicaid and Medicare Studies had basically said, in order to move towards health equity, right, that these things should not be illegal. As a matter of fact, started changing regulations, and only in the last few years to actually say that, you come out of the hospital for a couple of weeks, you could be provided some nutrition by somebody. That was an illegal act. Or creating a maternal health program like we do that's outside or on the edge of that reimbursement model. It was illegal to be able to do that, and that's changing. So where you saw companies doing maybe $500 million a year in post-operative or post-recuperative care, right? We know that there's other scenarios that exist other than post-surgery. And that's what we're talking about, is creating and developing those interventions reimbursed by Medicare, Medicaid, or commercial or not. These kinds of programs have to exist across the board. And there are more companies who are saying there is a way for us to be able to support that, to supply that, and do it also in the same spirit of equity, even as we go about it.
And we earlier heard from some representatives from the White House, and we think about the regulatory or policy barriers to this. Do you see this as a partisan issue? Is there room for bipartisan support? I see some smiles here.
No, I want to speak to this.
Yeah.
It's so funny because in saying this, I feel like I'm coming out. It surprises people, but I'm a registered Republican. And I co-founded Wholesome Wave, okay? And it surprises a lot of people. Both my parents were Farm Belt Republicans. My dad was from Western Kentucky. My mom was from Southeastern Missouri. But when someone's house burnt down, the entire community came together and worked with them to let them borrow the car, find clothes that fit the kids. If a tornado ripped through somebody's field and they're specialty crop growers and they didn't have access to crop insurance, everybody came to their side to pick them up, to provide them with food, to make sure they remained a vibrant part of the community, because that could happen to any farmer, could happen to anybody. It's like the conservatism where it's like, don't be a drag on your community, but if a community member falls down, pick them up, because you never know when you're going to fall down or when your family is going to be at risk. That's just being a good neighbor, right? This food should be nonpartisan. We talk about bipartisan because that's like getting into the goat rodeo of getting people to compromise on shit that just should be everyday common sense available to everybody, right? So I think we need to start changing the way we have these conversations and setting tables where we can invite people to have conversations instead of setting stages that are good theater for media to create screaming matches. Because the blame game is not delicious, okay? And another thing I want to speak to, because I think it's important, because when we mention deliciousness, there are people in our movement who are like, oh, that's so elite and boutique. It's like smothered jowls are delicious, you know? Osso buco. A lot of people think of osso buco as a gourmet dish. It's an animal shank. That peasants in the Italian countryside and in the Mediterranean figured out how to make delicious because they wanted their family to feel safe and secure when they had one meal a day at the end of a long working day, and that it made them feel like they could go to sleep and dream of a future, right? So deliciousness is not an elite thing. Things should taste good. Everybody, regardless of age, race, ethnicity, income in this country, deserve to put something in their mouth that makes them happy, but then when they swallow it, it makes them well. So that's what we're working toward, right?
That's great.
And I don't know if I went off topic, but
No,
and
that's great.
this is good business for everybody. I mean, imagine if Medicaid reimbursed fruit and vegetable purchases for low-income Americans. The grocery retail industry would boom. Yep. Especially, you want to talk about biodiversity? Imagine if corn, oat, and soy growers who are really trapped in a really low-margin business and have to borrow a lot of money to keep that 12,000-acre corn and soy rotation going, if they can diversify and plant specialty crops because the market just increased overall by 30% for healthy food.
Or you're bringing out things like there's 40 different types of lentils, and you're actually using sort of global diversity to actually create the nutrition and in an affordable way. Well, exactly, right? And that's exactly what we have to do. And to the bipartisan nature of this, I am always the practical realist, right? Who's putting forth your bills? How do your bills happen in your state house? How do your waivers happen in your house? And even you can even follow the money. today, where is that money invested, and who has investment in keeping things the status quo, right? Because the ask here is that it looks very different, right? And that's always a thing.
Can I add something? So we actually have a robust culinary medicine program at the University of Texas. Very excited about it. But as we think about bipartisan issue, we have to make sure that, especially when we think about healthcare, that our health systems are part of the solution and we are bringing them along. I'll tell you guys a story. So when we started the Teaching Kitchen, we were working with our medical school students. And the very first year in our culinary medicine class, I think it was a second-year med school student who holds up this vegetable and says, "What is this? I don't know what this is." It was a cauliflower. Not an exotic vegetable by any means, right? But that's a true story. If you don't know what a vegetable is, how likely are you going to talk to your patient about it? You're not. Right, that's not going to be part of your vocabulary. And culinary medicine, I am such a big fan of that approach now. I've learned a lot from that approach. But essentially, nobody wants to eat a sad salad because it's healthy. But our patients need to learn that from every which way that they can, right? Whether it's working the food that they're getting from Cook's Nook, or when they're in the doctor's office, or when their kids are in the school. It needs to be part of our fabric, and we've taken it out. It used to be part of our fabric. We have intentionally taken it out, and we need to put it back. Every physician needs to know that health is not just, medication and surgery. Your food has to be part of the solution and the conversation. The other opportunity we have, if we have to do this right, is think different from how healthcare has traditionally done it. So how do we teach our physicians? You're going to be an expert on the foot. You're going to be an expert on the ankle. We forget that it's the same leg, right? The same patient that is struggling with food insecurity is also struggling with paying their utilities, is also struggling with paying their rent, right? So as we think about these solutions, patients who miss the most appointments miss it because they have transportation issues. So as we think about the solutions, it has to be the whole person care approach, and it has to be everybody. I love what you said. Everybody has to be at the table creating these. Yes. Yes.
And that's one of the interesting things that CMS has said, right? I don't know if many of you guys talk about CMS. By 2030, right, our system is supposed to move from a fee-for-service model, which is what our healthcare system is today, to a value-based model. That means it becomes incumbent upon your clinicians to actually understand that you have these other things that are affecting your outcomes. And CMS has said, we won't reimburse unless the outcomes start to change. Not just that I saw you and gave you a pamphlet, pay us. It has to have an outcome that actually makes some sense, where then clinicians are now becoming responsible for what we call the social drivers or social determinants of health. I can't just say that you're diabetic. Hey, Larry. I can't just say that you're diabetic and confirm that clinical diagnosis and give you metformin and give you a pamphlet. I have to understand why you may not be able to come and see us, or why you may not be able to afford that metformin, or that you can't change your diet, or you don't have access to do that. And so that's part of the work that has to be done. And they're trying to figure out, how do we do this? Oh my God, we're responsible for this now? And it's a thing.
It's a thing. Well, I think you've done a really good job of laying out a lot of the barriers and a lot of the opportunities, and we have just a couple minutes left.
We could talk about this all day.
I know. I really wish we could. I'm sure we can have some offline conversation. But I would love to hear from each of you, just what's one thing you would like those here in the room to think differently about as it comes to being able to advance the food as medicine movement?
Really? That, and we haven't talked about it here, but I assume you'll start here on your list. Okay, all right. That in order for food as medicine to succeed, we have to know our populations and our communities, and that the solutions are targeted. what is needed for a mother postpartum maternal health as we think about the rate that Black women suffer maternal mortality and maternal morbidity. That solution is different, looks different than someone with a renal condition and you need to change that diet because you're trying to avoid cost of care around dialysis. This is actually a targeted conversation. And so the system has to be able to support different kinds of solutions in each of these kinds of different communities and populations, but it starts with knowing what is in that community and population.
Great. Michel?
Contact your culinary community. The next frontier for Wholesome Wave is gathering chefs from around the country who feel the way that I feel, and really helping them become a more active, informative, supportive part of the places that they call home, because chefs are business owners, they are employers, they are taxpayers. They're where people go to get married, where people go to mourn, business owners that serve these communities well. When we set the table, and a lot of y'all do tap into us, but you tap into us because you need us to do a course for a fundraiser, that's awesome. We will do that. We will help you raise money, but we can also, when we go to the Hill to talk about something, we don't get a staffer, we get the member of Congress. So, we can help you guys get your message out because we're trusted. We serve folks from the MAGA right to the AOC left and everybody in between. And it's like they come to, in my restaurant, it was like, Michel, my daughter's marrying a vegan. What do I do? Michel, my sister got type 2 diabetes. Can you help me? Is this organic thing real? They know they're going to get an honest answer from us that is completely nonpartisan. So we feed people. We care about you. We know that what we decide to make, it goes into your body, that has a profound impact on you. We have to sleep at night. So watch out because we're coming. So please, look at Jose. Look at, there's so many of us out there, but we never really aggregated, and we're going to begin to do that now. So please be ready for that, because I think
You need to come hang out with me.
Yeah, I'm all
I know
over
we
that.
already got the time clock ticking down.
Yeah.
So
Anyway, that's a see.
Shreela,
And
real quick.
Yeah, we should hang out too.
There you go, I'm ready.
I'm glad they did this panel.
So I guess what I would say is that I feel like the food industry has the best opportunity of really any industry as we face climate change and bad health, that food is the answer, folks. So we all eat, we all like good food, so it's the least partisan to boot. Yeah. And it has a huge impact. So we have such an opportunity to move the needle forward and work together little bit by little bit, one party at a time.
I love it, one party at a time. Shreela, real quick.
Yeah, so I agree with everything they've said, and I'm going to leave us with just one thought, which is that something that actually is a pet peeve of mine. It's quite upsetting to me. So when you go to your doctor today and you get diagnosed with diabetes, they put you on metformin. There's never a question asked by your health insurance company, how long are you going to be on that for, right? You could be on metformin for life, and that would be okay with your insurance company. The question we get asked in this food as medicine space is, how long is your intervention going to be? Can we stop it at 6 months? How long? And the diabetes is under control because of the metformin, right? The diabetes is under control because of the food, right? So it should be a decision between the physician and the patient, and not the insurance company that's driving these conversations. So I just want to point that out for something for us to think about. Yeah.
And metformin's more expensive than food.
All right. Well, thank you so much. I'll hand it back to Danny.
Thank you so much to all of the panelists. I just want to reiterate what Michel said. We all deserve, I love you all. We all deserve food that makes us happy and well, and I couldn't think of anything better to say. I want to remind you all, as you're moving about, to take your bags with you so that as many people can have a seat as possible. That would be really helpful. In the next session, I'm going to demand that you quiet it down a little bit. Everybody try to quiet down. Take seats. Everyone try to quiet down a little bit so we can start our next session, please, and take your seats. That means you folks in the front, you've got to keep moving. Move outside. Thank you very much. Nobody's listening to me today. Everyone take their seats so that we can get started.